Hi there, I'm Nathan Turnbull, an orthopedic surgeon with Florida Orthopaedic Associates. Today I'm going to answer some patient questions about joint replacement surgery. One patient asked, how do I know if I'm an anterior hip replacement candidate and if anterior hip replacement surgery is right for me? I have very few contraindications or reasons not to proceed with the anterior hip replacement for my patients. Most of my patients are a candidate for the anterior hip replacement. I'd say about 90 to 95% of my patients are candidates for the anterior hip replacement. Sometimes when there's more complex cases where it requires a more extensile or larger exposure because there's previous implants in, that would be one scenario where a patient is not a candidate for an anterior approach to the hip. But you should talk to your surgeon and have a consultation with your surgeon to determine if you are a candidate for the anterior hip replacement.